patients who are jaundiced, so that you would know what to do, and you certainly know what to say should you ever be confronted or presented in an exam with a patient who is jaundiced. And you would put Mrs. Horn on the good light, and you would look at in her eye, and you would look at the sclera of the eye. You look at the sclera because the sclera is white in color and shows up very well. And in order to do that, you depress the lower eyelid and you look at the yellow staining of the sclera. And you tell the examiner, I think my patient is jaundiced, deeply jaundiced, and he will say to you, make sure by looking at the sclera, and you tell him that you have, and she is pretty much deeply jaundiced. The next question the examiner is likely to ask you is, are there any other conditions where you can get a yellow sclera, bar being jaundiced? You tell the examiner no. I mean, there are other causes of yellow pigmentation of the skin, but they don't usually attack the sclera. The examiner will agree with you. And the next question he's likely to ask you is, in what is the likely cause of Mrs. Horn's jaundice? Or may say to you, what sort of jaundice are there? You tell the examiner there are 3 sorts of jaundice. 1, jaundice that is caused by liver cell disease, which we call hepatocellular. 2, jaundice that is caused by obstruction to the liver, biliary obstruction. And 3, haemolytic jaundice, that is excessive breakdown of red blood cells, because bilirubin, that is the name we give to this yellow stuff, comes largely from breakdown of red blood cells and that of haemoglobin. The examiner will agree with you and will say to you, in view of Mrs. Horn's jaundice, which is pretty much deep and severe, what